Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for women with urinary incontinence. Urinary incontinence means that you leak urine without intending to. And the main message of this video is that you should not think of urinary leakage as normal or even as an expected part of aging, and you should never think you have to learn to live with it. Tip number 1, keep a diary for at least 2 days. Keep a diary of all of the times that you leak and all of the times that you urinate voluntarily. Include in your diary the time that you went and the amount that you went, as well as any symptoms or feelings you had before you went, and anything that happened before you went, such as if you had leakage with coughing or laughing, or when you were changing position, like getting out of bed, or if you had a strong urge to urinate before you had an accident, or if you strain a lot when you urinate. Record all of these symptoms in your diary. Tip number 2, see a doctor. Bring this diary to your doctor, and along with other questions for your history and a physical exam, as well as a urinalysis, you and your doctor will be able to determine the most likely cause of your urinary incontinence. Tip number 3, avoid excess fluid and avoid or limit the amount of alcohol or caffeine. So it's important to limit the amount of fluid you drink, and to especially limit the amount of fluid you drink 4 hours before going to bed. Also, alcohol and caffeine can make you have to go to the bathroom more, so it's recommended to limit intake of both alcohol and caffeine. Tip number 4, if you are overweight, lose weight. Losing weight is an effective means of improving urinary incontinence. To determine if you are overweight, take your height and your weight and put them in a BMI calculator, a body mass index calculator, which you can get online. If your body mass index is 25 or greater, you're considered overweight, and you should lose weight to help you with your incontinence. Tip number 5, avoid constipation. Constipation can cause or make incontinence worse, and the best way to prevent constipation is to eat at least 30 grams of fiber each day. Tip number 6, bladder training. Bladder training is a very effective means for treating urinary incontinence. Here's one way of going about it. Go to the bathroom every hour, sit on the toilet, and try to use it, even if you don't have to go. Then, if you feel like going in between the hour when you're not actually on the toilet, use a relaxation technique to prevent an accident. Stand still or sit down. Concentrate on making your need to go to the bathroom less by taking a deep breath and letting it out slowly. Try contracting your pelvic floor muscles. Try visualizing your urge to go as a wave that peaks and then falls. Once you've gone for a week without any accidents between the times you sit down, you can increase the time between each scheduled going to the bathroom by 15 to 30 minutes. Eventually, the goal is to go for 3 to 4 hours without any accidents. Tip number 7 are Kegel exercises. Kegel exercises, or pelvic floor muscles, are another very effective way for treating urinary incontinence. You are basically strengthening and learning to use the muscles that control the flow of urine. To identify these muscles in women, what you should do is contract your finger, place your finger in your vagina, and squeeze the muscles around your finger. These muscles are these are your pelvic muscles, and these are the ones you'll use to contract during the Kegel exercises. Kegel exercises are done by squeezing these muscles, contracting them and holding them for 8 seconds, and then relaxing. This should be done 8 times and repeated for 3 sets. So you're doing you're doing them for holding for 8 seconds, doing that 8 times, and repeating it for 3 sets. This should be done 3 times a week for at least 20 weeks. Tip number 8, ask your doctor about pessaries. Pessaries are silicone devices that are placed in the vagina and help control urinary incontinence and can be very helpful. Tip number 9, if these above behavior changes and techniques have not proven effective, ask your doctor about a referral to a specialist. There are surgical options for treating urinary incontinence when these more conservative options fail. And tip number 10, believe in yourself. Urinary incontinence in women is extremely common, and these are effective ways for identifying and treating it. So I hope this video has been helpful. Thank you very much for listening, and have a great day.